Welcome you all to this first edition of the Nkafu Africa Health Forum. I'm going to begin by telling you that at this juncture, we are going to start the first panel. So I'm going to introduce the moderator of that panel, who is Dr. Denis Forestier. He's the co-chair of the Denis and Lenora Forestier Foundation and executive chairman of the Nkafu Policy Institute, a leading Cameroon think tank. Along with co-chair Lenora Lebule, he shapes and approves strategies, advocates for the foundation, and helps set the overall direction. He's also the chairman of the Meshai LLC, an international holding company with operations in the US and Cameroon. A surgeon by training, Mr. Forestier has always been involved in philanthropic activities and issues related to international development. He is the current president of the Association of the Cameroon Physicians in the Americas. He is also the co-founder and pioneer president of the Cameroon Professional Society, the premier institution of the Cameroonian professionals in the USA, focused on advancing economic opportunities and leadership development among Cameroonians. Ladies and gentlemen, I'm going to call on you all to maintain silence and to equally use the chat box for comments and suggestions. You can also indicate through the raise of a finger during the question and answer session. Thank you very much.
Thank you very much, Vanessa, for that introduction. You know, way longer than I anticipated, and thanks to our distinguished panelists and for joining us today for this first Nkafu Africa Health Forum. It's a great honor to be kicking this off and kicking this off on a very important topic. As mentioned earlier, our theme for the forum is realizing the potential, Africa healthcare delivery post-COVID. And I have been tasked today on this opening plenary to talk on effective health service and delivery in post-COVID Africa. And to really help us kick off this conversation, we've assembled three distinguished panelists to help us navigate this first part of the conversation. I'm really honored to introduce Dr. George Alemji. Dr. George Alemji is a clinical pathologist with vast experience in global public health laboratory services and systems strengthening. He currently serves as the senior technical advisor for laboratory services at the State Department in Washington, D.C., the Office of Global AIDS Coordinator and Health Diplomacy. And he helps coordinate all PEPFAR laboratory programs globally. So he wears a big hat in D.C. He's also a health scientist with the U.S. Center for Disease Control and Prevention in Atlanta, as well as the PEPFAR chair for South Sudan. Before then, he really occupied a lot of different positions, which you can see in the program. Associate Director for Science and Laboratory Advisor at the CDC Caribbean Regional Office, Acting Regional Director for the CDC Caribbean Regional Office. So it's a real great honor to have Dr. Alemji joining us here today for this opening panel. We also are privileged to have Dr. Pamela Oben, Dr. Pamela Oben Ayuk, who is a team leader and coordinator of the expanded program on immunization in Boya in the Southwest region of Cameroon. She has previously worked as a pharmacist and assistant coordinator of the HIV/AIDS Care and Treatment Center in Limbe Regional Hospital. And her coordination involves supervising and managing almost 4,000 clients placed on antiretroviral therapy. Dr. Pamela Ayuk, thank you very much for joining us during this for this opening plenary. Last, certainly not the least, my good friend, Dr. Ronald Gobina. Dr. Ronald Gobina currently serves as Director of Health Policy and Research and Nkafu Policy Institute. Is a nephrologist by training and working in the regional hospital in Boya. He has been very involved in the COVID-19 response in Cameroon and held and led the task force at the foundation on that. He's a member of the Cameroon Society of Nephrologists, the International Society of Nephrologists, and the initiative to strengthen health research capacity in Africa. Dr. Gobina, it's a great honor to have you on this panel. Well, to start, ladies and gentlemen, I would invite Dr. George Alemji. Dr. Alemji, George, you were at the driving seat, like many other people at Africa CDC and the CDC in general, in the fight against the COVID-19 pandemic. It came from nowhere. Folks were scrambling to make sense of how the pandemic was going to pan out. There were lots of predictions about how Africa was going to fare, or if I may say, not fare very well. Somehow, we are still standing in Africa. There has been a lot of changes around, supply systems. The continent has learned some lessons from the pandemic, in addition to all the other pandemics and epidemics that it has dealt with in the past. Now, as we stand today, as we kick off today, what is your overview of the COVID-19 pandemic and how we in Africa have responded to it, we've dealt with it, and what lessons overall do you draw so far?
Yeah, thank you so much. I only want to start by making this very, very important disclaimer that what I'm going to say today does not represent the position of my institute, but my own personal opinion, and that I have no conflict of interest with any other diagnostic institutions. That said, let me really take this opportunity to thank the forum, organizers of the forum, for bringing all of us together to talk about COVID-19 issues in Africa, and also some about the resilience and challenges and how we can move the continent forward. You're right, Dr. Foretia, COVID-19 started unplanned, and it affected the global community, as the economies and so on. And the continent of Africa was hit seriously because they lacked capacity in many ways, including diagnostics and vaccine development and so forth. But despite that, as you said, the continent was able to resist in many ways and standing strong. And we saw a lot of developments going on, a lot of challenges and solutions. So there could be three questions that I really want us to see how we can respond today. One is how was the continent prepared in terms of infectious diseases outbreak before COVID-19? And number two is how the continent is living with this particular virus at this time, and also addressing other health issues. And the third, I think the most important question is that is the continent ready for the next pandemic? What we know is that it's going to be another pandemic. The question is when and how would this happen? We know that when the COVID hit, it was not easy for the continent. Let's look at what was in the continent just before COVID, the infrastructure in place and how it has been leveraged, and what we'd see as gaps moving forward. First, if you consider things like the West African Ebola outbreak that was in 2014, we saw how the continent was just unprepared, particularly those three countries affected, Guinea, Sierra Leone, and Liberia. It took a long time just for Guinea to be able to confirm that this was actually an Ebola outbreak. But let's look at Nigeria that had this polio eradication surveillance system in place. This country was able to contain the lone case that came into the country, showing that there is need for health system to be strengthened to prepare for pandemic. With beyond that, I would like to say a lot has happened in the continent in strengthening diagnostic systems, general public health systems, particularly with support from the US PEPFAR program that has done a lot in the continent, Global Fund, WHO. And most importantly, I think the establishment of the African CDC has been a game changer. We've seen how this institution rallied governments together and resources and was able to support COVID-19 and strengthen a lot of public health systems. Now, when the virus hit the continent, sometimes around March, we will recall that it took us a long time to June, July before we could see tremendous improvement in diagnostics. This was because the continent had all these huge molecular platforms, people were well trained and so on, but no local manufacturing capacity all the reagents and the consumables and the PPEs were to come from China, from India, from the United States. There was global lockdown, there were flight restrictions, and even when the reagents became available, it took a long time for that to get to the continent. The West wanted to have enough for their people. So we heard a lot about equity in vaccines, but I would want to say that it wasn't just equity in vaccines, there was also equity in diagnostics. It took a long time for reagents to get down to the continent. But the good news is that despite all that, early enough in the pandemic, we saw that countries like Senegal and Morocco started producing rapid diagnostic kits. That was good news for the continent. Then the issue of the vaccine came, and all of us know the story of vaccine inequalities and so on. The West started clinical trials sometimes early in March, but the continent did not do the same. They had to wait for vaccines from the West. And when the vaccines eventually arrived after a long time, we also completely lack the infrastructure for vaccine delivery. So the continent, again, was not ready for delivery of the vaccines. There were also issues with even the treatment, right? When the West was condemning hydroxychloroquine, the continent was promoting hydroxychloroquine. Very important, again, I want to acknowledge that the continent did so well in genomic sequencing. We saw how the continent was the first to identify the Omicron variant from Botswana down to South Africa. So that was good news. But now thinking about how do we move forward, particularly the resilience that we are talking about, I would like to make a couple of recommendations that can start these discussions. The continent needs to see global health systems strengthening through the lens of what we call the global health security, pandemic preparedness and response, and continue to move in that direction. We saw during the COVID-19 pandemic that countries that had resilient health systems did better. Also, and most importantly, we should see diagnostic systems as being decentralized. We are dealing with an infectious disease, so you don't pull people together. So the continent should continue to support decentralized diagnostic systems, point of care, community testing, and so forth. Most importantly, there is what we call moving away from the silo diagnostic systems to integrated and multiplexing. We have innovative platform today that can measure or test for more than one disease. That was the benefit we saw during COVID. You just needed your reagents to do that. Most importantly, also think about strong surveillance and data systems. The issues we've seen in the past, including the Ebola in West Africa, was that the surveillance system was very, very weak. There is also weak, maybe what I would define as maybe epidemiologists in Africa or field epidemiologists, those who could actually get into the community, be able to support and outbreak and so on are still very few. So workforce development is very important, strengthen diagnostic capacity, training laboratory staff on epidemiology and so forth. Then most importantly, the African CDC has established what we call the regional public health institutes. I think there are 5 supporting the different regions in the continent. And at the national level, they are also working with governments to establish the national public health institutes. These are game changers for the continent. We should think about strengthening these institutions. They are critical for outbreak response and so on, and ready for any pandemic that can come up. Think about also things like the supply chain system is still very weak within the continent. It should be strengthened accordingly. Then, as I said, we should see health system strengthening in Africa across the entire continent. There is still very, very weak diagnostics and pharmaceutical systems within the West Central African countries. That is what we saw during the Ebola outbreak. So when we talk about equity in terms of diagnostics or vaccines, let us not see a little as something between the West and the African continent. Within the continent, system strengthening has not been equal. There's a lot of health system strengthening in the Eastern Africa and Southern Africa, North Africa, but West and Central Africa is still struggling. There was a lot of effort and strengthening of these countries during the pandemic for the genomic sequencing that I mentioned. I think this is something that should continue. Very important, I think my last point would be African regional partnership. We saw how rallying the continent was very, very important. African CDC played this very, very important role in bringing governance together. The government themselves were able to rally resources. I think they used the Afri-Zim Bank, the African development banks, and so on, and they work together as a continent. So this is something that the continent should continue to support moving forward, support the African CDC. I understand it's now an autonomous institution. That is the way that the continent needs to prepare for the next pandemic moving forward. Let me stop here, and I look forward to how we can continue to discuss this together.
No, thank you, Dr. Alemji, for that. Really, you've laid a lot on the table with this, and that's a real great start from the Africa CDC being a game changer in the process. Still, and despite the real efforts that were made, we still have significant challenges in strengthening the systems. Diagnostics has improved. But still, our manufacturing capacity in the continent still needs a lot of work to be done, as you said. It's very heartwarming to see the progress that has been made in genomic sequencing. And I really like your suggestions of really decentralizing, testing, diagnostics or so. In that, it has to be the point of care and testing has to be really decentralized to be able to ensure that the systems are strengthened. So thank you very much for that at that start. Dr. Pamela, let me get to you, Dr. Pamela, and get your opening thoughts on the lessons that you have drawn from the pandemic. Adding to what Dr. Alemji just said, especially on the ground, like working directly with folks on the ground. How has that been?
Thank you so much. I think Dr. Alemji, he did so well in setting the pace for this discussion. I want to start by saying that being someone on the field, the pandemic exposed a lot. It's almost like two sides of a coin. You have the positive and you have the negative. For the negative, I want to begin by talking about our capacity in responding to the pandemic. We were unprepared, just like the entire world were unprepared. But we are even more unprepared because we do not have manufacturing companies in Cameroon, in Africa in general. I actually realized that Africa has about 3% of production of pharmaceutical products in the world. So imagine in a situation where we have a pandemic and we need to be able to consume our own pharmaceuticals. We do not have sufficient, we have shortages. So this is where we found ourselves as concerned the COVID-19 pandemic, the testing capacity, but most especially the pharmaceutical, the vaccine production capacity, because we're in a situation where we have a pandemic, we need to respond, we need vaccines, but we do not have vaccines in the African continent. And being someone, the coordinator of an expanded program on immunization, we needed vaccines that would be able to cater for our target population, and we didn't have any. So the only way we could harness vaccines was to get involved in the COVAX facility. The COVAX facility, which focuses on providing vaccines, on providing diagnostic equipment to low and middle income countries. And this was the only way. And it really affected the system because I remember when we had AstraZeneca vaccines and we had limited supply. So we have these thousands and thousands of people who've received their first dose of AstraZeneca vaccines, but AstraZeneca vaccines for the second dose were not available. So this came a long way to show the limitation and the importance for Africa to have industries, to lay emphasis on the pharmaceutical industry, on production of vaccines, on production of hand sanitizers. When it came to production of hand sanitizers, we have pharmacists in the African country, in Cameroon, but we were not producing hand sanitizers. So it took the pandemic to show us that we could be able to produce hand sanitizers. And many of these young pharmacists and small local companies said, okay, we're going to produce our hand sanitizers and we're not going to look at importation, because a hand sanitizer of about 30 mils now became 500 francs, 1,000 francs. And it dug out our capacity as Africa to be able to respond. It might look small, but to me, it showed that we could do something to respond to this particular pandemic. Yeah. So I believe that it set the pace, and from there we'll be able to build on to that. Also, we have the presence of CDC, which has really helped, and we've been teaching, we've been bringing up frontline field epidemiologists. I, for one, am a frontline field epidemiologist trained, and we're able to respond to infectious diseases. We have monkeypox in the Southwest region now, and we've been able to detect several cases because our surveillance system has also been strengthened by the pandemic. So I think that this too has contributed to strengthening the surveillance system. We have cases of other vaccine preventable diseases, measles. We just recently responded to the measles outbreak in Limbe, and Akwaya and yellow fever in Limbe as well. So it shows us that with the COVID-19 and with more resources, we've been able to strengthen this existing surveillance system. And I think that to some extent, we are kind of ready in our surveillance system in early detection of these diseases in the African system. But I also think that we need personnel. We need personnel. The Western world needed personnel. We needed human infrastructure when it came to the pandemic. Africa needs even more, because we are at the level where we're not up to 1:1,000, one doctor is to 1,000 patients. We've not gotten to that yet. We're far beyond that. So we need human resources. And the pandemic got to expose that we needed human resource. You see, medical practitioners, we had to do so many things at the same time. You're managing patients, you're vaccinating, you're testing. And to me, it contributed also to it contributes to spreading diseases. Because when you have a healthcare worker who is managing a patient with infectious disease, and they have to go maybe manage another patient with a non-communicable disease, I think that it spreads this transmission. So in being able to improve our human resource system by recruiting more healthcare workers, I think is going to go a long way to help us to fight this pandemic. In vaccine, responding with vaccines, I think that it helped show us the importance of community engagement. We've carried out 4 vaccination campaigns, and when we had a better adherence to the COVID-19 vaccine was when we held community engagement meetings with various community leaders, and we used it as a platform to sensitize them on the importance of COVID-19 vaccination. That was where we got an improvement, an increase in vaccine uptake. But before, this was never something we considered in vaccine. In the EPI sector, we didn't really put a lot of focus on community engagement. So it took the pandemic to show us the importance of community engagement. I'll end lastly by talking about infodemics. Before COVID-19, infodemics wasn't really a problem, but it took the COVID-19 pandemic to show us how much infodemics can affect the uptake of various health interventions. As at now, we are barely at 10% vaccination coverage for COVID-19 vaccines in Cameroon. And in the Southwest region, we're barely at 6 to 7%. And all this because of infodemics. When we ask what is the challenge, they tell you, oh no, on social media, it says that. So we realize that in the African continent, we're consuming more of what is found on WhatsApp, what is found on various social media platforms, and even the healthcare workers. We realized that we are barely at 45% uptake of COVID-19 vaccines amongst our healthcare workers. And this is where the rumors and the misinformation stems from we ourselves, from we the healthcare workers. So this is just where we are right now.
Yeah.
Thank you.
Well, I think that's thank you very much. Thank you very much, Dr. Pamela Ayuk, for that. I think there are lots of things that that we've gotten in from yourself, from Dr. Alemje, and I think Dr. Ronald. There are lots of things. I'll pick up from what Dr. Pamela and Dr. Alemje said, and to really bring you in to talk about, we are talking about where we are, where we are today, how we are living in it, but also, Dr. Alemje really talked initially about preparing for the next pandemic, and I think this is an issue that we have discussed about. We've had different sessions to talk about how you prepare for the next pandemic, but how are we in the way you see the continent, the whole problem that we have of a communicable disease like the virus, a pandemic like the virus, is meeting us in Africa, where we have this growing burden of non-communicable disease. And you know this very well, as a nephrologist. You deal with it on a daily basis. The cancer rates across the continent are on the rise. And we have to do that in a system where, as Professor Dr. Alemji said, the systems are still weak to be able to deal with. So 2 questions to you: how are we dealing with it? But also, if we segue a little bit into the next item, how do we prepare the system for the next pandemic or so? Can we let me get your thoughts on that?
Thank you very much, Dennis, and thanks to the other panelists and all that they've shared. I think that the answer to your question lies again in the opportunity that COVID-19 has given Africa, the opportunity to do self-diagnostics. We have the opportunity. We have seen our strengths, we have seen our weaknesses. And when I want to summarize everything that we have experienced and the lessons we have learned, 2 words keep coming up in my mind. The one is the notion of standards and quality. And I would say that the pandemic exposed the fact that our standards are a little low and that our commitment to quality is very shaky. So we had this pandemic blow out into the world, and we got to discover that in Africa you have everybody is a researcher, everybody is a pharmaceutical industry. Somebody makes a video. I had COVID last night. I woke up in the morning, I drank a glass of ginger, and I declare this as the cure. It works. Share this in all your network. So what they are saying is that their standards for drug production, a few hours is sufficient to think of an idea, try it on one person, and declare that it works. And this is a big danger if we are going to work with this. The other thing is that we have a global pandemic has wiped out so many lives, and we're pumping a lot of money. Now, when money goes in and it is buried in what I would call consumables. So consumables is what logically, if you come tomorrow to check, it's not there why it has been consumed. When you spend on consumables and you leave nothing lasting, we have a problem. So the last 4 years teaches us that we can put in billions upon billions. And as it stands in 2022, take my country for example, we do not have a reference infectious disease center, which could have been birthed from all the spending that was done. So we're still in the learning process. We're still in the process of establishing what we will call standards. We're still in the process of building our commitment to quality. We have learned through this pandemic, and I'm not too certain that we're learning all the right lessons. We're surely doing some things right. I think the pandemic also showed that Africa had more up its sleeves than it knew. The prophecies about dead bodies littered everywhere didn't come to pass. We have some things working for us, and I don't see yet that we're leveraging those, whether it's the genetic advantage in terms of exposure to infectious diseases, or our antigenic pool, which makes us a little bit more resilient. There's so many things. Are we leveraging this? Are we using them? Can we see it already being engraved in policy? It would appear that for some of the African countries, talking about COVID right now is the once in a while, let's mention COVID is still around. But in terms of an active science and evidence-driven drive and initiative to build. So I want to see pharmaceutical capacity. I want to see diagnostic capacity. I want to see personnel training. Dr. Papela says we need people. Where are they? Mm-hmm. We've been 3 years and more into this pandemic. So there's a lot to be done. And I think a lot could have changed if we had the right notion of what it is in terms of international standards that can make a difference. We're playing with just about everything. We can declare that we can make drugs in Cameroon. 2 years down the line, nothing is done. Nobody is sanctioned. Nobody goes to check the claims. We're still low on the standards of our communication and our engagement to strengthening our own healthcare systems.
Wow, that's thank you for that. That's a big issue on standards and quality there. Which as if I link back to to Dr. Alemji talking about strengthening the system, to ensure that the standards and the quality we can get there. It always also begs to me the question of as we talk of this, the research capacity, and where are the researchers? I know that there are a few folks like yourself who are doing a lot of the pushing the envelope on the research, but where's our research capacity there? And there are trained epidemiologists, or there are pipelines for training more epidemiologists or so, but the whole issue of the research community really carrying this on and pushing the agenda is something that we've not seen as much of the research community carrying on. Now, I know that at the continental level, they've been a big push from the Africa CDC. They have the second conference coming up, I think in a few months or so. That creates a continued platform to continue to push a lot of this agenda. Let me come to you quickly, Dr. Alemji. Now, for the team and everyone who is joining us, please, let us know what questions you have for the panelists, regarding, how to build capacity, on the continent as we try to, get COVID-19 on our back end. So please let us know if you have any questions. You could raise your hand, or you could indicate, and I think the team is able to figure out a way for you to ask a question directly to the panelists or so, or you type the question in the chat box. But Dr. Alemji, a couple of things that I want to come back on. There are issues that we have regarding on I don't know if you got me, Dr. Alemji.
There was some
okay, it was breaking up a little bit. So there've been a lot of talk that you've mentioned on the diagnostic and pharmaceutical capacity across the continent. The challenges with that. Now, there is also the side which is the financing aspect of that of the entire system. To be able to help prepare for that next pandemic, in addition to at the same time dealing with the non-communicable disease side. Can you talk a little bit on the matching of diagnostics and the financing of it?
Yes, thank you so much. I think we've said a lot about those systems that must be strengthened, but I think the most important thing that the continent needs to do is that network and coordination among itself. Developed countries have succeeded because they were able to develop infrastructure. They invested both in the public and the private sector. The continent has failed in the past, but more recently we saw what the African CDC could do. That institution did a lot. Poor governments together, presidents were talking to each other. They engaged the Afrexim Bank, and we're talking about vaccines. I remember they were able to actually have funds to procure their own vaccines. So resources have to come if the continent understand that this is a problem. So financing, the governments have to allocate more funds for public health issues. The infrastructure has to be built. Local diagnostic manufacturing has to be in place. So funding has to come from the continent itself. Look in-house and you see the money, it is there. Dr. Gobina mentioned something which is very, very important, that we seem to put the money in the consumables because they can be consumed immediately and there's no accountability tomorrow morning. So invest, get the money and invest in system strengthening. Also partnership, right? We've seen a lot of system strengthening with support from global partners like the US PEPFAR program, the Global Fund, and so on. So you need to put all these resources together. And unless or until you do that, you don't succeed. So you don't rely on governments. The private sector is very, very important. The public-private partnership, the banks. I heard about African CDC, I think, raising $1 billion through MasterCard. Those are the networks that exist. So do that at all levels with all the resources and the partners you have. But as the resources come in, let's put that in our system strengthening. Dr. Pamela said it very well, and I said it, the epidemiologists are not just there. The COVID pandemic has taught us a lesson. So we need to focus on how we raise resources, and as they come, we think about how do we invest them and ensure that systems are strengthened and make sure that we are ready for the next pandemic.
Yes, no, thank you, George, for that. No, Dr. Pamela, as you see, you talked about the field epidemiologist, training, and you've been a field epidemiologist yourself. How do you see the continent, across Cameroon, different countries, really getting more folks into these areas of training in public health training? I know Dr. Alemji mentioned the Africa CDC, regional public hubs, training hubs, or public health training hubs that they have across the continent or so. And I think the Africa CDC launched a recent campaign to get folks. I think it was named after Kofi Annan, if I remember correctly or so, that fellowship. But we also know that the percentage of Africans who are in STEM fields is very small. It's the people who are graduating from the university with degrees in science, technology, engineering, and math. That proportion is still very small. I think we love all the other subjects or so, but we need to get more people into STEM. Can you talk about more training in public health, especially on women? We know that a lot of folks who were really affected with this, it has to do with some economics as well. So a lot of women were more affected by the pandemics. But training STEM, please talk a little bit about how to get more people into training across the continent.
Okay, thank you. I always say that public health is prevention, and prevention is the most effective strategy in managing or in the healthcare system, because when you prevent a disease, you're able to prevent economical burden and burden on the healthcare system, burden in every single aspect. So I think that epidemiology, we're having more and more epidemiologists and even people in public health. Many doctors who come out now want to do public health, want to do epidemiology, which is very good. And this is proven, like I earlier mentioned, by how quickly we detect epidemics or outbreaks. We've had at least 5-6 epidemics, outbreaks in the Southwest region just this year. And the fact that we're having this, some might think is because the Southwest is just prone to epidemics, but I think it's also because our system is sensitive. And this has been proven. So I see a lot of young people connected. It's just to encourage them that, please, we want epidemiologists, we need frontline epidemiologists, we need public health specialists, because we're in the African system. We don't have funds, we don't have a lot of money to fight or to manage patients when they're already sick, but we can prevent. So if we have epidemiologists, we have public health specialists, I think it will really help strengthen our system to detect early enough and to be able to manage before we have outbreaks that we cannot, that overburden our system.
Thank you for that. And Dr. Govina, in the day-to-day dealings, in the systems, so you deal a lot. Obviously, COVID and the after effects and the aftershocks, continue to hover on the system. But you are dealing with, patients who, are already most of the time, cash trap and ways of financing care is already difficult. But at the same time, they have non-communicable diseases, diabetes, a growing diabetes, folks with kidney failure who require dialysis or so, and you're having to deal with that. Now, can you talk a little bit about, the system itself, as far as like hospital systems across the continent? What lessons are they learning, and how has it affected the delivery of other services like, dialysis care, for example?
So I think that personally, this country, our country, for example, and maybe many other African countries are a work in progress. And the healthcare system is really low, even in that work in progress. But I say work in progress because we are far from where we need to be, but some work has started. And when you see the little work which is being done, you are able to appreciate where the need is even greater. I'll give you the example of a strike action. Well, it's common right now to have patients on dialysis care going on strike, going on the streets, marching up to the governor's office, and it's on TV. And one of the things that we always think about when they do that is, yes, they have legitimate needs. They have a serious problem that needs to be looked at. And you'll hear the back comment from the patient who has a cancer. And they're like, what about us? The care of dialysis patients is subsidized. When will they think about us? The patients with hypertension and diabetes also want their drugs taken care of, like the patients who have HIV. So the system is struggling to pick up one or two things. And as I said, we have a learning problem. Because after decades upon decades of running a problem, for example, the HIV program, where the country is giving drugs free of charge to citizens, we should have learned enough, taken country ownership of such projects. So let PEPFAR do its part, let the international partners do their part. But the problem is that when the partners have a suspension for one day, the whole program crashes. So there's no engagement. It's like there's no value in the outcome of these projects. We're just interested in the project running and the money coming. But the outcome is about the lives of the actual Cameroonians. Because my idea is we cannot solve all the problems at the same time. We have to start somewhere. And if we start somewhere and we do it right, we'll learn lessons that will help us progressively pick up other areas. I would not advise any person who has hypertension to pray that the government takes over the responsibility of providing drugs free of charge. You probably know my mind on this, because they will celebrate wonderfully. The government will buy the drugs beautifully for the first 4 months. And in the 5th month, they will say, oh, there's a problem and the container is yet to come. And you will spend 3 months without medication and you cannot buy anywhere, because that's what happens when the government takes up a project and it's free. It stops existing in the pharmacies. Like you cannot see tuberculosis drugs in pharmacies. So when the government takes over, you need a serious government with a very solid functioning system to give them that level of trust. So I am looking at it on two sides. I would love the government to continue what it's doing, but really strengthen its strategy to make sure that this works and this is scalable to other areas, including non-communicable diseases. But I will also look at another aspect where the government has a role seamlessly to facilitate, because with or without funds, with or without government engagement, there are people out there, researchers, philanthropists, organizations, ready to make a change in people's lives. They are doing it else. They have the funding. And usually they want to come, set up a program. All they need is some little facilitation, like allow me come in. And you would see someone in our typical funny system where you're bringing something to people and you're like, what's my cut? And then it discourages people. So even where we have PEPFAR, we have other programs in the country, let's facilitate these people. They have so much that they can do, so much that they can give. And if our learning is right, we'll take from their lessons. How are they so effective in doing this? We copy from that, personalize it to our context, and make sure that we can move from covering not just dialysis care, not just infectious diseases, we can move towards every sector of society. The dream, the golden dream, is universal health coverage. But I think the journey to that point is a little long if we don't change our learning strategy. Thank you.
Thank you, Ronald, for that. there are some questions that have come up in the chat box, and we need more questions to come up. I will select a few and bring it for the panel, the panelists, for you all to like comment on it. I know one question from Wilfred is African governments received a lot of financial and material support from COVID. Cases of mismanagement, how does this affect control of pandemic and lessons we draw from this? I think that has been mentioned already or so, but we could get some more feedback on that. There is a question on you raised issues about human resources. This is a question for Dr. Pamela. Human resources is very important, but I've been a graduate student nurse for a while. Okay, this is one, and there's been challenge in how can I join a health network? So that's a question on, Pamela, you are looking for people. There are people out there. They're saying they are, they're available. Then the one question for Ronald, or one question out there is, you spoke on research capacity on the continent. What do you think a country like Cameroon that has had and still has a number of researchers with approved and certified medications, which is not supported by the government, approved and certified medications, which is not supported by the government, probably because imported drugs and vaccines are privileged. Now, there are some thoughts there, but Ronald, I'll have you start with that last question. I think you had mentioned something like that, because I think am I allowed to declare my drug, my own medication, that it cures something?
We've had so many declarations, and they keep coming. And again, it's about standards. Unfortunately, the argument about standards and quality is also used for corruption, because it's used to justify why we deal with only one person. There's a monopoly. I'm not castigating any nationality. Forgive me if you're of French origin. But all our companies for approved drugs happen to be French, and the drugs have to come through France. And you meet representatives of drug companies. Drugs are made cheap in several parts of the world, very expensive on the Cameroonian market, and they will explain to you, we have these drugs. You get homologation from the ministry, yes, but it has to be vetted and validated and checked quality-wise by some other country in the world before it gets into Cameroon. So there's a channel that exists. And that's why I say our country is a work in progress. Because this channel exists, on one side is maybe justifiable by saying they did some groundwork and found that this is the best channel for us. It could also be that it's also a guise to monopolize and have commissions existing or non-existing from a particular source, when we can open up the sector and have cheap medications which will serve Cameroonians, but why not import the expertise to make drugs locally? So I can imagine that if you have a multinational in a monopoly system who is interested in protecting his medication, he can make sure that Dr. Alemji has a team of people, they want to set up pharmaceutical industry in Cameroon, and maybe they want to make just normal saline, a perfusion, a drip. Everybody knows drips in Cameroon, which is used every single day in hundreds of thousands of tons. Why will we import this? For example, we import what we use in the dialysis centers. So you have a container full of water traveling over the seas. We have water in Cameroon. We can make the composition for this in Cameroon, have them available in the dialysis centers. We're importing water with a few chemicals added to this, whereas we have the expertise. So I will not blame anybody for thinking that there may be secondary interests in all this. That's why I say we're in work in progress. We have many things we can do to break that cycle. Increase your weight. When your weight is heavy, you can actually break some chains that have been holding you down. Networking is another thing. Advocacy is another thing. We have to build teams, network, show that it can work, and scale it up. I was doing an internship, a training program, and I was hosted at the Baptist facility in Mutengene, and we were made to visit they are a pharmaceutical company. They produce some medications on the spot. And my dismay 5 years later is that it has not gone to scale in Cameroon, that they can do this. The government has not taken it up to say, oh, you're doing this, let us increase your capacity so that for a start, pilot phase, just supply all of Southwest with this drug that you make. It's not being done. Mm-hmm. So the capacity is there, the support, I think that's the sense of the question that I get, doesn't seem to be there. And you have so many questions that are coming up. Mm-hmm. We have a dynamic young minister, and I think that if he gets wind of some of these things, he's the kind of person who will go visit that center and is like, what's going on? Why don't we have this? I wish that such things could happen. That's really my prayer.
Thank you, Dr. Pamela. Any comments to the previous questions?
No, I think I'm completely okay with what Dr. Ronald said. I'm a pharmacist, so I really see from where he's coming with. We have a few pharmaceutical industries in Cameroon, but what we basically produce is just the minimum. I think we can scale up, and the CBC has actually proven they can do that. We have Afrique as well, which is a pharmaceutical company that's producing a lot of the medication in the market. We can have many more of those in Cameroon. Why not produce vaccines? If we need to import the know-how, the technical skills from other countries, I think we can do that. And in the long run, it saves us and it employs our own citizens in really big pharmaceutical companies. So it's the way to go. If we need to go far, then we need to start now. Thank you.
Well, I think we are really coming to the end of this conversation. Let me get you and Dr. Alemje. Actually, we'll just go one round for some closing comments. And I will hope, Dr. Alemje, you talk a little bit in your closing comment on that preparation for the next pandemic. So, which unfortunately we didn't have a lot of time to talk about that.
Yeah, thank you so much. That question, if we are ready for the next pandemic, the answer is that we are not ready, but it seems like we are on the path to. It will be a missed opportunity if we don't employ lessons that we've learned from the current COVID-19 outbreak. There were a lot of opportunities out there. One and the most important, I think the continent need to rally force behind African CDC. We heard about African CDC and the regional 5 public health institutes and the national ones. Those institutions are very, very important to strengthen our health systems. The diagnostic manufacturing is very, very critical. I said it earlier that we had all the high throughput machines during COVID, but you could not diagnose because you have to wait for somebody else to. So local manufacturing of laboratory diagnostics, we had Senegal and Morocco and a couple of countries are already doing that. We heard a lot about some developments in vaccines, plants in Africa. I'm so glad the way Dr. Gobina is talking about these issues about drugs and clinical trials. There were a lot of stories during COVID about herbal medication. I think there was one Bishop Cleda in Douala, the government of Madagascar. So we need to really move our trials to the standards and move that forward. Pay a lot of attention in terms of our surveillance systems. Network, the governments have to commit a lot of resources in this area. And until we do that, we may not be ready for the next pandemic. So we are not yet there, but I think the opportunity is there and we don't want to miss it at this point. The continent needs to move, rely on itself, and then network before you talk about support that you want to get from others. So thank you so much.
Thank you, Dr. Lemje, for that. Dr. Pamela, any closing comments?
I think the COVID-19 pandemic helped us young people to know that we can do something as little as producing hand sanitizers, as little as getting involved in surveillance and strengthening the surveillance system. I think there is more room for that. There are a lot of young people here and we are researchers. We should do the research. We should go in and come up with solutions, with ideas that can help build a better Cameroon. We've started, but we're moving very slowly, and it's time to hasten up with our existing resources. Thank you.
Thank you very much for that. Dr. Govina, any closing comments from you on, how do we effectively deliver care in post-COVID?
Yeah, I think it's time for a lot more networking, really, really, really stepping up our learning curve. So learning has to have an impact on life. If not, it's learning for leisure. We don't have room for leisure in what we're learning. So Cameroon has a history behind it. It has experience with COVID, experience with so many other things. Let's learn, let's put those lessons to good use, not just into papers and theses and dissertations, but into policy changes, into actual, investments on the ground in those areas that matter. The potential is there. Given the opportunity with the team of people we have in Cameroon, I think a lot can move forward. Thank you.
Thank you for that. And I think that, the bottom line is, personally, when we always talk about potential, everybody talks about, we know of the potential, the African potential that's there. But I think that, the African potential has been demonstrated. It has been demonstrated, and the COVID-19 pandemic allowed the Africa CDC, in my mind, to demonstrate that potential, because it really was a breathtaking, sight to see the amazing work that institution did in less than 2 years or so of forming, and how it rallied and was really ahead of the curve. And so when folks ask me about the potential, I say, no, we've demonstrated it. As far as healthcare is concerned, it's been demonstrated. Just look at Africa CDC. And I think if we can replicate that, across the continent and, in our countries, if we can have those systems also in place, and for an institution to work, half like what the Africa CDC has been doing, I think we would be well on our way, to make a real genuine progress. With that, ladies and gentlemen, we would conclude this opening plenary. Thank you, Dr. Alemji. Thank you, Dr. Pamela. Thank you, Dr. Gobina, for this wonderful conversation. I will pass it over to Ms. Vanessa Fombin. Thank you.